Well, hi everyone. Jim McGuire here with VITA Learning. Today we're going to go over denture teeth with Mr. Mark Wagnesiel, a denturist up in Canada. Mark, how are you doing out there?
Super duper. It's above zero. It's above freezing. We're
Above
happy.
zero. And that's centigrade zero, so that must be above 32 degrees
Yes,
Fahrenheit.
we're
If I
getting there.
recall.
It's coming.
So good. We're actually here in Southern California. Had a little rain yesterday, but the weather's looking good, getting closer to spring. So we're ahead of the curve for it with you as far as the weather goes.
Always
A
are.
little bit above freezing for sure. So, well, everybody, today like I said, we're going to go over denture teeth, taking the bite out of change, transitioning to cutting edge denture teeth. Mark's going to go through the entire process of how he went, how he came to be working with VITA denture teeth, and also in his practice being a denturist. He's a wet finger dentist almost, as far as what we would kind of call here in the United States. So he has a lot of insight as far as working with dentures, with patients, and he really has learned a lot of tips and tricks and some ideas that he can provide you with, so that you don't fall into the same pitfalls that he's already learned and about and has worked around. So just a couple things. Your phone, everybody's phone is on mute. So if you try to shout out, I'm not going to hear it. Mark won't hear it. What we're going to have is questions at the end of the PowerPoint, if you will. So use the question box on that right-hand side. There's a panel, and just go ahead and type in your question. We will be able to address that usually at the end of the program, but if something's pertinent at that specific time, I'll certainly interrupt Mark like I often do and say, hey, Mark, what about this or what about that? So please use that question box, send that question in, and we will address it as soon as we can. So we also will, just so everyone knows, CE is going to be provided later. At the end of the program, you should receive an email from VITA North America, the Education Center, in which you can provide us information to get your CE. This will be recorded, and it is posted usually on our YouTube channel or other social media VITA North America learning websites that we have, whether it's Facebook, YouTube, LinkedIn, and so forth. So you will be able to readdress or look at that the webinar, kind of check out points that maybe you missed. So please do so at our VITA Learning website. So again, we're going to be talking with Mark, taking the bite out of change, transitioning to cutting edge denture teeth. I am going to turn this over now to Mark. So Mark, I will now make you the presenter, and we will see what's going on with you. So you are now the presenter. We can take a look at your monitor.
Awesome.
Right.
You can see me?
Yes.
And you can see the PowerPoint?
Yes.
Awesome. Are we ready?
So take it away.
Done. Let's get started. Good morning, everybody, or good afternoon, wherever you are on this beautiful planet. Thanks for joining, and appreciate you taking time for yourself, for your growth, and most importantly, for your patient, whether you see them directly or in a laboratory setting and you never see the patient. There's a person at the end of a denture, and this person is usually a senior citizen, and they have a quality of life, and we're trying to improve that quality of life. So good morning, and thank you for investing in yourself. First off, we don't slap teeth together. Woot, woot. We do not slap teeth together. What we do is a complicated. Building dentures is hard. We have to build it so it functions, it looks good, patient's happy with it, and it sits on soft tissue that's movable. we have an extremely difficult job. And those of us that work directly in the mouth, we have a lot of experience dealing on soft tissue. This isn't a hard tooth surface, it's soft tissue based, and it has its own idiosyncrasies. I've spent the beginning part of my career banging my head on the wall because what school taught me should work. It should have worked, and then the patients and making complaints. So I'm 51 years old. I started caring for patients when I was 17. It's now 34 years of my life. I love what I do for a living. Absolutely, there's stressful days, but this is still the right career path for me. So let's get into it. We're going to talk a little bit now about our common issues. So what do we deal with dentures and commonly from dentures? Well, first off, denture teeth chip, break, pop off. That happens to us. A patient can't chew well with the new denture, so they come to us and say, geez, my old denture fits better than my new denture. So that's always a fun conversation to have with people. The new dentures are more loose than the old set, multiple relines, and it's still not working, and the case still keeps coming back. Denture base fractures, that's always fun within the first 3 months. Food collects under the denture, but no reline warranted. What we do clinically is when we take our index fingers and we push, especially on the bottom denture, and if there's not a lot of rotation and a lot of give on the denture, so if you don't see a lot of give horizontal, vertically, or rotationally, usually doesn't need a reline, but then why is there still food getting under it? And we go, it's a denture. You got to get used to it. And that's why the denture adhesive market is $150 million a year market in the US alone. People get tired. So the new denture feels too big. And soreness, that's very common for us. So those are a lot of our common issues that can be very stressful dealing with patients. You have to keep in mind, we usually deal with senior citizens as well with dentures, and that plays a factor into this as well. And now with implants, the temporary implant denture is preferred over the permanent. So they like the they like the temporary one. So these are things that we're going to explore in the next hour, and I'm going to walk you through a few of us. These common issues cause us a ton of stress, not only for the patient, but for us. Whether you're in the lab or whether you're the doctor or the denturist, it's it can be very stressful when you're dealing with someone. Charles Darwin stated, it's not the strongest of a species that will survive, nor it's the smartest, it's the one most adapt to change. And this is something now that at year 34, I've really realized this isn't about me, this is about the patient, and this is about me adapting to the patient. And then I need systems and product that can adapt with me. So let's talk a little bit about VITA teeth. I'm going to start on one topic and then slowly weave our way through. We're here to talk because, again, you have switched or thinking of switching or something that's different. The first thing I always want to mention is we are creatures of habit. We go to the same gas station, we drive the same way to work. When we go to the grocery market to get our peanut butter, if the grocery store changes the location of where they've put the peanut butter, it's a major problem because I know the peanut butter is on this aisle and I always look up and that's where the peanut butter is. And if they change it, it's a major problem. We're creatures of habit. So you're used to using a certain kind of denture teeth. This is what someone taught to you, especially at the beginning of your career, and you know it and you know how it works, and especially you know how to troubleshoot it, and you know the idiosyncrasies of it. And now you're looking at changing. And of course, change is always seen as a threat, and it's difficult. So let me talk you through it. What I've realized is that you have to get out of your own way, and this is really hard. Getting out of your own way, and what my wife Robin always says, Mark, you always have to remember to get out of your way. And that means this isn't about you. What did you miss? What can you do better? How can you learn? How can you grow? And try not to come in with preconceived notions and such. It's time to change. So VITA Pan, I'll just talk a little bit briefly about the company. VITA Pan was 1950s design theory. So every denture tooth company out there has different products and different kinds of denture teeth to suit different market needs. So VITA has VITA Pan. This is 1950s theory and design theory. It was bread and butter. It's what the company was built on. They came up with VITA Pan Plus in the 2000s. There was an updated design. So not only did VITA Plus, but other manufacturers came out with denture teeth. And I remember when they all came out, everyone looked at them and they went, holy cow, wow, these are bigger and different. So VITA came up with VITA Plus, Ivoclar came out with Veneris, Mertz Dental came out with Integral, Horace Kulzer came out with their, I'll call it their premium line. So all these companies came out with it because there was a renaissance and sort of a change in theory. MFT for VITA is a premium tooth at an economy price. So it's there to fit in a certain market segment. PhysioDens from VITA is an anatomical design tooth. And now VITA came up with Excel in 2017. This is our trending technology and design and shade. So with all due respect, I'd just like to say, for those of you that can see me, this is my cell phone. It's not the newest, but it's an S10, so it's a Galaxy, Android S10 from, and I don't use a flip phone anymore. And gosh, when phones came out, I used to have that big brick phone. Remember those? So you have to keep in mind, technology changes. Do you stay up with it? And do you keep up with it? So if you're using teeth such as 20-degree teeth or such, you're using technology and theory from the 50s. It's not the 50s anymore. It's time to move on. And that's what we're going to talk about and try to wrap it up in an hour. I have an hour to, again, answer some questions, tempt your tummy with the taste of nuts and honey, get you excited, and to seek to understand and to learn more. Posterior types, they have the cuspiform that, again, similar to a 20-degree tooth design. That was 50s. That was what was used and the theory and thought process back then. Syniiform, also 50s design with a shallower cusp, with somewhere like a 10-degree tooth. So again, we came up with all these different kinds of inclinations, thinking that's going to help somebody, thinking that it's not going to rock the denture. But we see it, I see it differently now, and I'll get into that with you of why I don't use flat teeth anymore. PhysioDens is a centric tooth occlusal design based on the teachings of Dr. Eugen End, and now Lingoform is the current trending lingualized occlusion concept, and it can be set alternatively, even working and balancing, in point-centric contact, etc. So we have a lot of variations that are available for that tooth line. So they follow the square tapering ovoid selection criteria, so much like what we know. So that's it. There's just going to be one of the biggest changes that on Excel teeth and PhysioDens and the MFTs, there's no more neck on the tooth. So people would always come back and say, well, the tooth looks pretty big. And I'll get into that. It's not. It's actually based quite on natural tooth design. So VITA teeth. So all the VITA teeth except MFT are made from acrylic glass. So it's 85% polymethyl methacrylate, 14% silica, which is quartz, which is glass, and 1% shade. This is an acrylic glass tooth. So it's acrylic glass because glass is more like enamel. So it has the characteristics of enamel. The biggest thing to remember is that it has a lower temperature point. So if you're going to flame it with a flamer, you have to be careful because you can burn it. But the trade-off is this. You get good looks, you get enamel qualities, an enamel look like a real tooth. It's hard. So the shelf life on this is usually, shelf life meaning the wear life, I see repetitively now in my practice is 7 to 10 years. But the trade-off is this. It's acrylic glass. Acrylic, you have to polish when you grind. This you don't have to, it self-polishes. So that's a big plus for me, is that I don't internally have to grind, or excuse me, I don't internally have to polish any of the cuspals or anything that I touch on the tooth anymore, because it's self-polishing. That's a big one for me now. So it's an acrylic glass tooth, 7 to 10 years of wear life expected on it, and you don't have to polish it. It has the characteristics of enamel. So it also has opalescence. So VITA puts opal into their teeth to, again, that's part of the glass aspect of it, to make it look more like natural teeth and enamel. So it has, again, the famous picture of enamel teeth. It also has fluorescence, and they actually put fluorescence in it because it's caused from phosphorus. So that's the enamel and the phosphorus that's in our enamel. And this is a great picture taken by a now retired VITA rep from, his name was Ken Parker in Western Canada. And he held up a black light, and you can see the left side is glowing, so it has fluorescence, that's VITA. And then the right side is a non-VITA tooth. It's the #1 denture tooth in North America. And it doesn't. And so you say, well, what's the big deal? You don't walk under black light all the time, Mark. Well, but this is what also is emulated from fluorescent light in your office, from natural light. And it does give off those tones. And when you don't have the phosphorus in it, this is what happens. The tooth is more dead. So VITA, the philosophy is to make it look real and lifelike. I have, again, after my time, never met a patient that looks at me and says, Mark, can you make me a fake looking denture? I want my teeth to look fake. No one's ever told me that. Sure, they want them straight, they want them white, but there's that fine line of, yeah, but I don't want them to look also fake. Now, one would argue, well, Mark, bleached teeth are fake looking, but I've also built teeth that are extremely light color, but still look like they belong in the person, and that they don't look chiclets and they don't look fake. And that's one of the founding philosophies of the denture teeth. Okay, so VITA teeth have fluorescence in them. They also have what's called the magic triangle, which is golden proportions. So the teeth are actually designed with golden proportions. So what is that? Well, that's the magic triangle between shape, shade, and light. They're a golden proportion tooth. So when you think of things like the pyramids and Michelangelo's David, everything is mathematically related to each other and equated to each other, as are the denture teeth. Because again, your face is all mathematically mapped out. The width of your nose is in relation to the width of your teeth and to your chin. We know this now through study. You can take your whole head and mathematically tear it apart and mathematically equate it to each other. And so the denture teeth have to be like that as well. And not a lot of companies do golden proportions on their denture teeth. That's a little bit more and newer trending for us, that companies are doing that, because then it looks like it belongs. And that's the most important thing here. So we're going to talk a little bit about Excel. So that's the platform that VITA is moving forward with. So Excel and Lingoform. That's also the platform that the digital is based on. So the digital component of the teeth for those that do digital. So that's the Vigo Vionic and Vigo Vionic. It's all based on this. So the Excel has a little bit of a larger and more beefed up neck area of the tooth. Why? Because if we're going to deal with implant components, that's typically where the metal is. So what they wanted to do was, instead of they wanted to control actually the interdental papilla and the width of it. So they made the neck a little bit stronger and a little bit bigger, as well as the curvature of the tooth and such. And the incisal edge is a little bit thicker. So the incisal edge is a little thicker on the Excel, and of course now on the digital aspect as well, because those are going on implants. So now we've had the issue of denture teeth fracturing and chipping on the incisal edge. So I'll talk a little bit about that right now. So when you say, what does the patient want? Well, again, they want a denture that doesn't look and scream denture, even though it's white and maybe straighter. They don't want it to scream, well, look at me, I'm wearing a fake appliance. It has to function, so that it has to work for them. And there's some things that we'll get into on that aspect momentarily. It has to work for them. And they want something that's going to be durable and last. But we have to think about a patient now. Most of us, we again build dentures for senior citizens. So number one, beginning part of my career, I used to tell patients, please touch your teeth together. So they would touch their dentures together. Well, Mark, you idiot, they can't feel their teeth. How do they know they're touching together? Yet we use that word, bite, close, touch your teeth together. There's no nerves in the denture. All the nerves are gone because the natural teeth are missing. Well, how do they tell that their denture teeth are together? They tell by hydraulics. The denture sits on gum. Gum is like a sponge. And when you bite together in Centric, it creates a certain amount of pressure on the ridge structure. And that patient learns when I touch my teeth together in Centric or swallowing, it's this much pressure. Now when I'm chewing, there's more hydraulics or more pressure coming down, and they feel the difference in pressure. And now they know that's chewing pressure or biting pressure. So now we have to think of it this way. When denture teeth break or chip or we have problems, the patient cannot tell that that individual tooth hit prematurely or that there was anterior contact, which what caused the break. Now that we're also implanting the denture in and securing it down more, the jaw has a certain chew cycle and the patient can't tell, and then they fracture the teeth. And what do we do? And what did I do at the beginning part of my career? I pick up my phone and I'd phone my VITA rep and go, the teeth are breaking. And what I realized, what did I say? Get out of your way. I set them wrong. They're in the wrong spot for that patient. If your teeth are repetitively chipping, they're chipping because they're in the wrong spot for that person. And we'll get into this. I'm going to give you some tips and tricks to manage that issue. We have to look at what's necessary for that person. And that's what I've learned now over my time is what does the patient want? And when you can deliver something and you can deliver it so that it's fitting more for that person and I'm molding myself to that person, it's going to help. So freedom and centric. So this is a philosophy that's found in linguiform and physiodens posterior teeth only. By definition, it's a flat area of the central fossa upon which opposing cuffs contact and permits a degree of freedom. So it's uninfluenced by tooth inclines. So it's not running up the tooth inclines. It's actually a little bit of freedom in the tooth. So what is that? So if you held your teeth together in centric, lightly, and then wiggle them, front to back, side to side. Don't go in excursions, just go a little bit. The teeth have a little bit of freedom. Now, Jim, can you see me? Can you pop in on mic or unmute yourself? Can you see me? Hello, Jim. Okay, that's freedom.
Yes,
Awesome. You can see me
you.
wiggle. This is the wagon seal wiggle, everybody. So denture teeth are not locked together. Thanks, Jim. They can wiggle. You have a little bit of wiggle in real teeth. That's freedom and centric. You got a little bit of wiggle room. That's freedom. And freedom, everyone, is good. All right, freedom, everyone, is good. Why is that? It is not possible for me at the ripe old age of 51 to pinpoint accurate centric every time I eat. Depends how I'm holding my head, depends what I'm eating. It depends what I'm chewing and that the teeth have to go through what I'm chewing. That's why our bite's not locked together. We have a little bit of freedom. We forgot about this in denture teeth. There are only a handful of denture teeth that have freedom and centric in them globally, produced by a handful of companies. Why? Because we forgot about this in the 50s. We built the teeth to lock together in centric. Oh, sure, they had working and balance occlusion and anterior contact, all that's there. But when you hold them together in centric, it's tight. There's no wiggle room. We need that wiggle room. Because now, what are you asking? And why is this important? My dear colleagues, building denture teeth out there, you are asking a patient now that cannot feel to land in a zone. If the bite's locked together, there's a hit and slide. The hit and slide's what's killing us. Again, the hit and slide's why I've been banging my head on the wall for the first 10 years of my career. It hits and slides into position because they were not able to pinpoint centric. So now on the left side of the screen, you have that little bit of wiggle room, that little bit of freedom to allow for compensation, okay? Because you are asking a senior citizen to bullseye centric every time. Most senior citizens are on medications. Their nervous system is starting to deteriorate. Their muscles are starting to deteriorate. Things aren't as sharp and crisp anymore. And you're asking someone to bullseye centric every single time. When they can't feel their teeth, they can't tell, they've lost that biofeedback to their central nervous system that how accurate Centric is, and you're asking them to pinpoint it every time. You know that's impossible, right? They can't do that. I can't even do that, and I can feel my teeth. That's why you need to have that little bit of freedom and use denture teeth that have freedom in them. Otherwise, on the picture on the right, it hits the guiding planes and slides into place. What does it do when it hits the guiding planes? It rocks the denture. So what does that cause? Remember I said the denture fits, but food collects under it because now it's rocking and it's lifting the denture and food gets under it. What happens is then the teeth chip. The teeth can chip as well because again, we locked everything in. This cycle is anything but locked in. You have to imagine the mandible. It is held together with different sets of muscle groups bilaterally that have to function together at the same time. Holy cow. And accurately. And as we get older, I'm not as accurate. Our muscles change, our nervous systems change. So now we need to use denture teeth that have it. And since I've been using denture teeth that have that wiggle room and that freedom, because freedom is good, what happens? It's really been an eye-opener for me for patient success. So this is what it looks like on an articulator. So now this is it wiggling in Centric. You have a little bit of wiggle room. And now I'm going to move it. And now, sure, we can do full working and balancing. So these are linguiform teeth. So what that does is you have a little bit of wiggle room so that when you're eating, it has a little bit of a helicopter pad to land in. That's what this is. It's compensation. It creates more stability. And it's going to cause less issues for you and for your patient. So that's the beauty of what Freedom and Centric is. And now if you're thinking of switching or have switched product lines, this is important. And this is the benefit of what the product is going to give for you, and especially as a clinician. So now I want to talk about the real chew cycle. So remember I talked about now, everyone has a chew cycle. So bear with me, I know the screen is blank. I have a unique fingerprint. I have a unique retinal scan. I have a unique tracking of my jaw. My jaw tracks a certain way based on me. So now take a look. This is a video of people chewing. So they have real teeth, but this is the point of what I want to show you now is they're going to chew a little bit. So watch them chew the apple, but I want you to look at their jaw and watch the angle of their jaw. Your chewing is in a teardrop, but the teardrop varies from patient to patient. So now everything's lined up to work. So you don't hit the guiding planes, everything slides in, you have a little bit of that helicopter pad to land in. But when you see them eating, are they eating straight up and down? You see that chew cycle straight up and down? No, it's not. It's on a cycle. Look at it. It's a teardrop. And it's, look, there's quite an angulation to this. What are the back teeth doing? The back teeth are mincing. So they're mincing the food. Okay. Now this is chewing gum. Again, it's the same point where the teeth are flowing. There's a teardrop cycle. You actually can even see the freedom of Centric in it. There's that little bit of wiggle room so that they can land in that helicopter pad. That's going to create stability for a denture that sits on soft tissue. And it's also going to prevent the rocking of the denture, and it's going to prevent the chipping of denture teeth. So take a look at this patient, and now show me, what do you see different? Look at their chew cycle. It's more vertical based versus that horizontal angular. So now we can actually tip the teeth differently on this patient because their system works differently. They're a little bit more vertical. So I'm going to pause the video for a minute. So when I first started, we were taught to look at midline, smile line, the color, the triangles, things that you see in the mouth on a wax try-in. And we would look at the aesthetics of it. No one ever taught me to look at the future function of it. What's their chew cycle going to do? What does it look like? How does it function so that I can set the teeth better within their chew cycle so that I don't run into the problems and keep banging my head on the wall? So how do you identify that? How do I identify chew cycle in a wax try-in? Well, get your paper ready because I'm going to show you. Okay. All right. This is a patient. She's going to say, now on a wax try-in, we would say 66, 66, 66, Mississippi, Mississippi. And I would be looking at, do the teeth follow on the wet and dry line? Is the midline right? All of these things. I want you now to train your eye and look at the function. So take a look and see what her jaw does. Do you see it move to her left? It comes out to her left. Watch, I'll swing the camera over. Look at that move. Love it. Can you see it? So you can see her jaw's posturing forward, and then when it postures forward on 66, it also tracks to her left. Now, what am I going to do in a setup? Now I can clear things out. I know that on the guiding planes on her left side, I need to give her a little bit more room because she likes to drift out that way. So I can accommodate that. Even on a digital denture, I can accommodate for these things and I can adjust them. And then it's going to be more in line with what she needs and to function within her chew cycle. And these teeth allow you to do that. Next patient walks into my office, comes in, she says, Mark, my teeth are loose. So now I want to ask them, when are they loose? Well, after I talk for a while. You have to appreciate what's happening after they talk. If they're talking, they're moving their mouth. When they move their mouth, the teeth are hitting. They can't feel them hit because there's no nerve there. And over time, it's such a slight little hit. What happens is the dentures dislodge. So I got her to say days of the week and months of the year. So I think this one she's saying days of the week. So watch her jaw and how it tracks. Did you see it? You see it? You see how she swings out to the left? Look at that. Okay, so now I know I have to clear things out on her left side, which means the guiding planes. So buccal upper, lingual lower for both sides need a little bit more room. And then you can make those corrections and now all of a sudden the denture doesn't move the way it did. So how do I identify this? Is I've taken our normal words that we use, 66, Mississippi, days of the week, months of the year, and not only am I looking at the aesthetical value, but now I'm looking at the jaw tracking and the teardrop and the three-dimensional teardrop. So not only does it move vertically, but within the horizontal space. And now I'm able to modify the teeth. And then VITA teeth aren't locked together, so I have a little bit of flexibility. Now they're acrylic glass so that I can grind them without damaging them. And I'm able to modify that to the patient. So days of the week and months of the year in a language cover the phonetics of that language. And the phonetics are the mouth shape and jaw position to form that phonetic. So when you have a patient say days of the week, months of the year, you are moving the jaw to again, pronounce and form that word. And that's what I've used now to track the jaw. And you have to make sure they say it in English and their mother language. Because sure as shoot, if they're speaking Mandarin, they're going to speak Mandarin at home, not English. Yet I've done the wax try-in in English. So you have to make sure that you do it in their mother language and you watch their jaw track. So now I've shown you a picture of real natural teeth moving in a teardrop to show my point, and that there's a teardrop cycle. Showed a 66, how it's going to drift out to the left. And now days of the week also, in this case, drifting out to the left. But now this is why they were coming back and saying that there was troubles and it was loose. And now I'm able to identify that and then modify it to that patient. I can't do that with other denture teeth. I can do that with freedom teeth, and that's important. That comes back to this point. What is your adjustment rate for dentures? So what we see is 2 to 5 times. So on an upper and lower denture, they're back 2 to 5 times for me. So I get a fee for the denture, and then can expect that patient to come back 2 to 5 times. So now in a pandemic, for us, clinically, we add about an extra 10 to 15 minutes on per patient. So as I speak to my colleagues, so the dentist colleagues and my other denturist colleagues, that's a pretty fair number. So we're saying about 10 to 15 minutes to do all the COVID checks, So you have a mouth rinse, depending on where you are. Here in Alberta, in my province, we have to do a pre-treatment rinse, but you have the telephone check first before you make the appointment. Then they come in, they have to do a written COVID test. We do a temperature check here. These are things that are mandated by the government or by my college. So generally speaking, although the rules may change slightly, we're adding about 10 to 15 minutes on per person because we deal with aerosol. So this is the kicker for us. We deal with an aerosol component. That's why we have to be careful. And so on 4 patients, that's an hour. So I've lost an hour out of my day. And now the patient's coming 2 to 5 times. So what does that mean? Most adjustments are about 20, 30 minutes in length, plus now the COVID on top of it. And then I have to clean everything well. Plus now all the PPE that I have to wear because now it's an aerosol generating procedure. So if I, for example, make $2,600 on a denture, say the lab fee was $700, that left a subtotal of $1,900. My office overhead expense to run my business is usually about 75%. So most denture clinics are about 75. Dental offices are usually a little higher, so they're about anywhere from 80 to 85 or so percent. So that left a net profit of $475. 2 adjustments, I've only made $275. 4 adjustments, I made a whole whopping $75. You want to up your game. So number one, it's let's put the dealing with the patient that's having issues aside with their denture. If we can cut that adjustment rate down, you're more profitable. So you're more profitable as the dentist, you're more profitable as the denturist. If you're the dental lab that's supporting that dentist and you switch to these teeth and now all of a sudden their adjustment rate drops, they're going to be loyal to your lab. Why? Because, well, the lab's building teeth that work and the patient's not complaining. And now they see that benefit. And so this is a financial aspect for us. We have to be more careful and more efficient now more than ever. Especially if you want to even take the aspect, and I had a colleague say, but Mark, even what's important is you're actually bringing that patient, that senior citizen that may have a depressed immune system or such, or underlying health conditions, you're getting them out less to your office, which is less risky. So that's a benefit as well. Because remember now, this is for us here to stay. COVID's not going to go anywhere. We're just learning to live with it and manage it better. So the less that a patient can come out that has issues, the better. I've already in the last year treated patients that have had lung transplants and serious health concerns, but they still need their teeth looked after because they still need to eat. The less we can bring them into the office, the better. So not only do you have the financial aspect of it, but now you have the pandemic aspect behind it, but now you also have the stress aspect behind it. This is important. So I'm using product that's going to help me reduce adjustments and make it better. So remember, 1 adjustment a day at 30 minutes is 2.5 hours a week. That's 10 hours a month, everybody. That's 1 full day. That's a full working day that you work for free. So if you can bring that number down, it's huge. Count up your adjustment rate. Or you ask your dentist to count it up and you say, I'm going to drop that down for you. This is a big deal. So you have to count it up. Okay. And remember, in dental school, they teach you 1 missed dental appointment requires 2 to 3 more to recoup the cost. So if you have a no-show, it takes 2 to 3 more to recoup that, which is why now dentists have gone to confirming their appointments 2 to 3 days in advance so that if someone cancels last minute, the front end staff have time to fill that space because they need to run efficiently. And they need to run that the dentist is making money and he makes money while he's working in the chair. So again, the cost of a denture appointment and again, just an adjustment is phenomenal. It's expensive for us and it's frustrating for the patient because they're coming back. Why? Because their mouth is sore and they have a problem. So again, the Freedom and Centric now reduces denture dislodgement because now I have that window and that helicopter pad to work in. It reduces the friction ulcerizations or sore spots because again, when you hit and slide, the denture tips and then it rubs on the gum and the rub creates friction, which causes the denture sore. So we're able to reduce that. It also provides better fit, less need for soft liners, and now is more efficient for the practitioner and better for the patient because now you're building a product that's more in line. So again, you want to watch the chew cycle, and now I've given you some tips to how to identify that chew cycle. So now you can move around those teeth to help with that patient, but I'm using denture teeth that are allowed and can work. It reduces implant damage and denture damage as well. Now in a pandemic, this is more important than ever, but I want to talk quickly about professional happiness and freedom in Centric. The World Health Organization listed burnout as a disease in 2019, and it's classified as you losing interest in your job, you're burned out. Repetitive problems with a patient due to a locked-in bite causes you stress. Stress over the years builds up. When you apply freedom and Centric, not only are you going to benefit your patient, but you and your psychological happiness as well in your profession. It's going to cut down on, in the lab, the repetitive complaints that come back. It's going to cut down on, again, as I point over to my treatment room, patients that comment and have the same repetitive problems to you. Again, that builds up over time. If you hear it about it year after year after year, it does wear you down. So that's why I'm asking you to try VITA if you haven't. The type of teeth you use matters. And if you're using it now, really what's in your hands? You have the ability now to change things and to modify things. It's fantastic. So we, as myself as a global advocate and trainer for VITA, and VITA itself, want to further our relationship with you, and ergo the patient that places their trust in you. So thank you. This is a quick list of the representatives in North America, and if you're outside North America, then just please go on to VITA.com, and then we can find you your representative if you don't know, if you're around the big world somewhere. So thank you. So again, since this is going to be taped and put on our social media platforms, I'll carry on, but we do have that list as well, okay? So now you can come back to that. So I'm gonna pop out for a quick second and switch over, so bear with me, because now we're gonna run over to the camera. Okay. Awesome. All right. Jim, can you unmute yourself, and just want to make sure that everyone can see this?
Yep.
Nice.
Loud and clear.
Okay, so this is that little bit of freedom right in here. So out of the factory, it's about a millimeter box to work in. So the helicopter pad is about a millimeter, which means you have about a millimeter green zone to land in and move in. Now, what happens is, again, we've been building denture teeth that are quite locked together. So a standard working and balancing setup functions like this, so that there's the contact of the lingual guiding plane against the upper buccal. Everything should be hitting and contacting on the articulator with the teeth, okay? That does not work like that in real life. Sorry. What happens now in real life is the patient is chewing on a chew cycle, and that chew cycle varies to that person, whether it's more vertical, whether it's more horizontal. And then the risk comes where we line up and we hit the guiding planes here, for example, or here, for example, and it slides into position. So it hits and slides. The patient can't tell you it hits and slides because there's no nerve to the denture teeth. They can't tell. So the hit and slide is what's causing the damage. So what VITA has done is they have that little bit of wiggle room and that little bit of freedom, okay? And then they've also incurred gapping so that it's not super tight, and you have a overlap here. So we're used to setting denture teeth that, I'll say 20-degree teeth, are quite knuckle tight. Everything was kind of tight and squished together. And now on a setup, I don't have that. I have these little gaps and spaces in, which I will again show you soon. This is important because it allows now for that freedom of when the patient's going through their chew cycle, that they're able to function without hitting and sliding into position, causing the problems. they're able to function within their chew cycle, land on a helicopter pad, and not have that contact. Okay, so that was big. The other thing I want to bring up is 20-degree teeth, the way they are made, and because they're so knuckle tight, they mill food. So milling means you need to touch together and it needs to grind it like this. It's milling like flour, like stone on a flour. And it's this way. Lingual form teeth and physiodens and MFT, they're designed to crush. So it's like a mortar and pestle. It's mincing. So for all of, bear with me, for all of you out there that are wet finger that have worked in, how many times has a patient come and said, I can't eat lettuce, can't chew lettuce? And it was like, because you can't break the fibers of lettuce when you mill. But when you have a mortar and pestle and you're going in and you're hammering it, like lingual form and physiodens and now MFT do, you're crushing it. These are crushing teeth. And now that works far better in the function. So now it comes up and it's crushed by the upper opposing cusp inside the fossa like a mortar and pestle. And the teeth are far more effective that way and far more efficient. So we have freedom. Then we watch our guiding planes. And in the good old days, we were taught that there should be contact, buccal upper, lingual lower. And now I'm saying, no, you don't want that. On these teeth, you want the buccal upper and lingual lower to have no contact on them so it doesn't hit and slide. This isn't a milling tooth. This is a crushing mortar and pestle tooth, and it's far more effective. I have wiped out the entire complaint now of I can't eat lettuce because it's getting crushed. It's far more effective. So this is the first thing I wanted to show you was about the guiding planes, the freedom. Okay. Second thing.
Mark, can
Yes.
you just repeat that? You on my end, it went silent for about 6-7 seconds.
Okay. So I wanted to again show you the freedom, the guiding planes, the hit and slide, that you don't want the bite locked in and knuckle tight. That's not good. It doesn't function like that. And the patient functions in a chew cycle, okay? And we don't want the hit and slide. The hit and slide is what causes all of our grief. It is the #1 cause of our grief. And as the patient gets older, they have less tone, less neuromuscular and muscle tone. So then I can actually come in and all I do is I can grind here and make that 1 millimeter box bigger and go 2 millimeters because I'm making this platform or the helicopter pad bigger. And I can do that to create more so that it has more tolerance, especially on the elderly. So I'll say this. In your knowledge, through your lives out there right now, do senior citizens adapt well to change? Most of you are going to go, no. So then why do we build them a denture and change a lot and open it up and do all these things and expect them not to have any problems adapting to it afterwards? So we have to build a denture that has more freedom and flexibility in it to help with that adaptation. If we need to open the vertical, then we need to, but then we have to consider how are they going to adapt to it after the fact. That's the beauty of the teeth, is that they're adaptable so that we can change that for the person, okay? So now I want to show you this. So I did a model. Here's a model. And I just took it out of production and I want to show you. So it's natural teeth. On that side, that's a lingual form posterior, and there was our equivalent in North America. So that's a standard 20-degree tooth, okay? And that's what we use. And so I show this to patients, and and we can use it as a marketing tool to say, well, if I wanted to charge extra for the German teeth, okay, why? Well, this is what we're going to use. Patients can look at it and say, well, yeah, that looks more natural based than this. And then you can help educate them, not only for yourselves, but for the patient to understand the price difference. You know, the other thing that we look at it, even as for those of us and my colleagues here in making dentures, this is more natural based. This is 1950s thinking. That's what we had back then. This is not. This is more trending. This is more common. Pardon me. This is more trending and this is more natural based. And this is where we've been going with denture teeth. Okay? For the reasons now that I'm laying out for you. So this is a nice little tool to show patients as well. Okay, so now I have this card. So we saw this card before in the PowerPoint. Okay, so on it, okay, we have this side is our Dentsply, and this is Excel. So the biggest changes is, again, Excel will be a little bit bigger in the neck area. So it has a little bit more of a profound neck to, again, hide metal. Okay, so it's got a little bit of a larger neck surface. Okay, has a little bit of a thicker incisal edge. You don't have a collar anymore. The collar was put there for us to put the wax up to. So that was just an idea for dental technicians back then to have something to wax to, where now we don't put a collar on, so you can wax anywhere that's necessary to allow more adaptation to the patient and the patient's needs. So for smile lines and things like that, it's far more effective, and it gives us less interdental papilla, which is really important, because then the patient always in a wax try and smiles really, really wide and says, oh, I can see wax. So the wider neck surface and no neck allows us to hide the interdental papilla and make it even less than we could before. So again, it's not 1950s anymore, everybody. It's time to move forward. You're certainly not using a phone from the 50s anymore, are you? And you're not driving a car from the 50s. Why are we using denture teeth that are designed from the 50s? It's time to move on. We're getting better. So this is the difference between teeth that have opalescence and fluorescence versus not. They come alive a little more because they have a little bit more texture and surface texture on them, like enamel does. So that's one of the benefits of the teeth. And as we slowly start to wrap up, and we have about 5 minutes left, I want to show you this. So this is a setup. Okay. So yes, I used a little bit of different colors on here just to show, but this is how we check. We are taught to do this and check on an articulator and check to make sure that the denture teeth work. Nobody out there on this planet can reproduce this, because you've locked this condyle into position and now you're rotating this condyle. You can't do that in real life because one condyle doesn't fuse and lock, does it? So I don't do this anymore on an articulator when I set teeth. I want to now mimic a chew cycle. Is that chew cycle more vertical or is it more horizontal? And then I'm able to check the teeth. So let's do that. So quickly, these are the cusps that come into contact with the fossa and its counterpart. I circled them in red, okay? So these are the cutters. These are the mincers from the mortal and pestle. And on lingualized occlusion, it's this one down here. So for today's purposes, we're not going through a setup course, but I'm going to point it out. Now, remember buccal upper, lingual lower. This is I coat this in green. This is freedom. I don't want any contact on these cusps. And the lingual of the lower, because this is where you get the hit and slide. So when you hold the teeth together like this, you can see they are not knuckle tight. They have gapping in them. There's a little bit of space. Why? So the food stays on the bowl to get crushed. It doesn't get pushed off. When it's knuckle tight, the food gets pushed off. That's milling. This isn't milling. That's not effective anymore. That theory isn't accurate anymore. You want a mortar and pestle crushing tooth. And then what happens is I can go through a chew cycle. So I know, oh, they swing out to their left. I have to pay attention and I function more and I move the articulator. Now, I can even do this on hinge articulators. You can move things. You just have to learn how. And now I'm able to, again, mimic a chew cycle, and then I can check, because now I've marked the teeth, and now all of a sudden these little marks are showing themselves on the guiding planes, which means now I know that there was a hit and slide, and I'm able to adjust these teeth to function better for the patient. So that's how I check it in a lab. I don't use articulating paper. Articulating paper bends, even the silk stuff. It bends and you can get wrong readings. I use this Staedtler Lumicolor non-permanent marking pens. Made in Germany. Okay. Yeah. Okay. And what that does is it's more accurate. It's more finite, so you have to watch for it. You have to look for these marks, and then you can see them, and then I can adjust the denture tooth. So now for those patients that are swinging out into different types of chew patterns, I'm able to modify it. And then there's your freedom in Centric. So it has that little bit of wiggle room, and then I check the chew cycle. And then when we do wax ups, depending on the patient, because there's no neck, I'm able to draw the wax where I want, and that actually I can shape it to alter the aesthetics of the tooth. So instead of the tooth dictating it for me, I'm dictating it. I'm in control, not the tooth. And that's the beauty of this, is that I can then modify the wax setup better to the patient, less interdental papilla, and such for that specific person. So again, you don't have a knuckle tight setup. It's more open. And now I'm showing how to check the teeth regarding working and balancing. Now, how do you do that in the mouth? So if the patient comes in on an adjustment and I have an issue now, and say it's even implant based, what do I do? So if you bear with me, I'm going to show you. So I have articulating paper here. I have a Q-tip, and I take that Q-tip and I put it and I coat it in Vaseline. Okay. And then I take the Q-tip and I rub it onto the Vaseline to impregnate the Q-tip with the dye. And then in the mouth, I would dry off the denture, and then I can come in and I can color things. Okay. So I can color the cusp tip, I can color here, I can color the anterior if necessary. Okay. And then I would go back in the mouth, and then I would have the patient talk days of the week, months of the year, in English and in their mother language. And they're going to move and talk and function for me. And then I'm able to go and then look. So for example, if there's an issue, this blue mark here is going to transpose itself onto the incisal edge down here, and then I'm able to look for it. It'll be slight, but it'll be there. Or for example, the buckle up here will transpose itself down here, and then I'm able to see it in the mouth. And then I'm able to adjust it, and I don't have to polish it afterwards because I don't have to because of the acrylic glass. So the first order of business is getting over the fact that the teeth are bigger than what we're used to from Dent Supply, from our good old 12 Ediths and 24 Freds. the teeth have a little bit more girth to them. Yes, they're acrylic glass, so they have a better enamel and better characteristics to them because the patient doesn't want it to look like chiclets. We're also trending with new technology and new trends, which is important. We have the flexibility of the tooth in terms of waxing up an interdental papilla and no necklines. So you have to get over yourself to say that the teeth are too wide or they're too big. They're not. They are based more after natural teeth and natural occlusion. Then we have the ability of the freedom in Centric, that the teeth aren't locked together and that they function and they have a landing pad. And then we start to adjust and modify the tooth to a person's specific chew cycles now by identifying the teeth like I've marked for you. So green are buccal, upper, lingual, lower. Those are the freedom cusps. Red was the cutter, so the pulverizer that fits into the fossa. Okay, and then I would also check the anterior, usually with blue, okay, to go in and check for that in the mouth on a wax try-in. Days of the week, months of the year. And then that allows me then to provide somebody with a more in-tune denture to their specific chew cycle, i.e. their fingerprint, their retinal scan. I'm building teeth more for their chew cycle and their abilities. And as the patient ages and has more issues and less tone, I'm going to give them more freedom, more flexibility in it. And all I have to do then is just grind the guiding planes to create a little bit of a bigger box to work in for them. Freedom is good. And when you do that, I'm using product that allows me to change and alter myself to the patient, and I'm modifying myself, and then to the patient specifically, and that's the beauty of the VITA teeth. And that's what I wanted to share with you today in our hour together. A little bit of why do I use it, and what are the benefits? And the benefits have been that I have cut my adjustment rate down tremendously. And it's been a real eye-opener for me to do that, and with what I've shared with you. So Jim, if you want to jump back on, we've basically spent about an hour here going through it.
All right, Mark, that was fantastic. Really love it. From a Dentures perspective, it's really nice to see that. So, the information you provide has been wonderful. So, greatly appreciate it. So I'm going to go ahead and put my screen up here, and
so remember,
just go ahead.
Remember, everyone. Number one, we don't slap teeth together, and number two, be a superhero to a patient or to that doctor, to that dentist, because at the end of the day, this is about cutting your adjustment rate down. This is about being more efficient and helping a patient with their quality of life. We don't slap teeth together. Be a superhero, and dentures are awesome. It is not the end of the line or you're a cripple if you get a denture. It doesn't have to be like that. People can function well and eat again. It's a big deal, everybody, because when you mince food, you're able to roll it in a ball, you're able to swallow it better, then the stomach can break it apart. Your digestive system can absorb the nutrients better because you minced it. And then we've actually helped patients get them off laxatives. I have medical doctors phoning me because, well, how did you get this patient off a laxative? Because they're chewing more efficiently. This isn't about me. This is about VITA and the VITA teeth and understanding the theory. It has been a huge plus for me in my practice. The difficulties is you got to get out of your way, and you always have to look at the patient and say, how am I trying to adapt to them? I'm getting better at it as I get older. Certainly there's issues that I miss, absolutely, but we're striving to make it better, and we can. Be a superhero. I'm telling you, you could get someone off a laxative, they're your patient for life because you're treated a person. Thanks, Jim. Thanks for investing in yourself, everyone. Thank you.
Yeah, it's a great perspective, Mark, and I think it just kind of hones in on communication. Many of us here in the United States, not being denturists, but technicians, we don't really concentrate on the patient end necessarily, but we have to understand that these are some questions maybe we have to start asking the dentist about the denture case and not treat them like a cookie cutter denture for every specific patient. So we do have plenty of questions.
You want to up your game as a lab? Start using the teeth. Tell the doctor you're making a change. Keep the price the same, and then track the adjustment rate with the secretary afterwards. Then you go back to the dentist and say, "We cut your adjustment rate, saved you this many hours, which is this many dollars." He'll be with you for life. It's not, you guys. It's attainable. I see it because I deal with the patient directly. You can do it through a lab equally. You just need a little bit of extra work. So you got to track some things, but I'm telling you, the adjustment rate will come down. We know this from feedback that we've received from other labs that have switched. The adjustment rate and the headaches have dropped. And then the doctor is loyal. Yes, Jim, sorry.
That's right.
Getting all excited.
I like it. Yes, because you can always, laboratories can add it as added service, added value to what they're producing today. So it's great. Anything we can do to help the end result, the patient and the dentist, and the communication between the lab and the dentist clinic, all the better. So it's great.
Indeed.
So we do have a question from Dan. Earlier you had spoken about self-polishing, the teeth kind of self-polish.
Yes.
Can you elaborate on that any more?
So microscopically, when you cut acrylic, it leaves an abrasion on the acrylic. And now because of the impregnated glass particles or silica inside VITA teeth, it changes that abrasion, and then the teeth polish because they're glass. So as they function against each other, they polish each other. Whereas in acrylic, the abrasiveness will stay and get worse, and it actually wears it down. Whereas because of the glass, when you wear it against each other, it starts to polish itself. So that's why, hence self-polishing.
So it's almost like a wear kind ceramic material, because it is
correct.
It has a large percent, 14% of a ceramic filler. So that's good. And as a technician or denturist, but does the Freedom type setup tooth design, does it make a quicker way to set it up? Does it help on the technician side as well as the patient?
Yes. Yeah, it's fast because you're dealing with a mortal and pestle. The upper cusp goes into the lower fossa, and then all I'm adjusting is the guiding plane for that specific chew cycle. And it's quick because it has an easy find centric, where again, it drops right in because you have the upper cusp come into its antagonist lower fossa. So it's a quick setup. In the days that we're able to meet again, please come to a course, because you'll see it where we can go in and I'll teach you how to do this. And it's fast, and it's not that much of a change in your everyday routine than you think it would be. It's quick, but the repercussions from it are large in terms of satisfaction.
Yeah, and we've got a ton of webinars for everybody that with Mark Wagenseal throughout the year. We're doing some end-to-end type, class 2, class 3 against natural dentition. We've got a large array of different topics that Mark, you'll be covering. So everyone should look at on our website, on our VITA social site, and look up and see what the next programs are. You should see something through your emails as far as the future webinars that are going to be coming up.
Indeed.
So,
and follow me on social media. So I'm also on Facebook, Instagram, and LinkedIn. So look up Mark Wagenseal, and you can follow me. I post cases on there and Freedom bits as well. So we're here to support you. I love my professions as a dental technician and as a denturist here in Alberta, and I want to give back to a profession that has done me well. And this is about giving back, and this is about supporting you and your success, and ergo the patient.
Yep, definitely. So I'm going to pronounce their name wrong, but so forgive me. Is it Risha? If she or he has a question, if you have to do an adjustment, do you need a special burr?
Okay, so the answer to that question is no. However, you do want to use as fine as you can. You don't want something that's got big teeth on it, because you will leave big striation cuts, microscopic.
Oh, you just froze.
Hence, then you would run into that. It just takes longer to polish. Am I unfrozen?
Yes. You got too excited,
Jim?
and the camera could. Yeah, you got too
Can you
excited.
hear
The
me
camera
now?
just couldn't. Yes, I can.
Yeah.
Now you.
I
Yeah,
get
there you go.
passionate. So yeah, the more fine burr, the better. Okay.
All right. All right, so I just threw on there a technical support line from the VITA standpoint. You know, you certainly give us a call to have if you have any questions about the topic, about the denture teeth, VITA denture teeth. Paul or myself can help you here at the hotline. This is Mark's information. Mark, with the cuss tips, another question, with the cuss tips open, in other words, not in contact or locking, do you still have that centric, that tripod effect in contact?
Yes.
Okay.
I apologize. I'm gonna have to show that to you, either on a setup course that we do here with the camera, but I hope one day in person that I can really show you. You do get a tripod approach of the upper cusp sitting in the lower fossa. So again, the mortal and pestle. You do get that proper centric contact position, but again, it can swivel a little bit, so that tripod can change slightly as we modify. Okay, but there is a proper stop there. Yes.
Great. So it was interesting. We had some questions about this as well, about the jaw, the chewing cycle, right?
Yeah. Cool, huh?
So, yeah. So again, I think some technicians here in the U.S., mainly non-denturists, but technicians for Canada and the U.S., because they don't see that patient, they've been asking, well, the chewing cycle, how's the best way to talk to the dentist about how to communicate what that chew cycle may be? I mean, is there a communication tool, or is there a method that a technician can say, hey, doc, what about the chewing cycle? Give me some dominance, or is there a dominance left side, right side, vertical?
Yeah. So part of it is okay. I need a little bit of more detail about the patient. So how old are they? How many sets of dentures have they had? What is their general health? Are they frail? Are they zippy? Tell me about it. Okay. The other thing that I want to mention, so you can develop a document. So the quick questions is the patient frail? How's their health? How old are they? How many dentures have they had? That'll kind of formulate for you. And then part of that then leads into, if you don't see the patient, I would always err on the side of caution and err on the side of I'd rather give them more freedom than less, which means out of the factory, again, it comes with 1 millimeter. I'd rather increase that and go to 2 and just make that change in the lab. You can also ask the doctor to, again, identify with now what have I showed you with how to identify the chew cycle. You can actually draw out the chew cycles, and we've done that for labs where they've got a chew cycle and then they circle it of what they think the current chew cycle is. Is it more horizontal? Is it more teardropped? After saying days of the week, months of the year in English and a mother language, then they can circle that on the prescription form for you. So, VITA and myself and Jim can help you draft documents to try and gain that information. This is about, I want to help the doctor be more successful, ergo, in the patient, reduce adjustment rates, save money. So if I can get a little more information, that's going to help me because I can modify it when I do it in the lab and custom build it in the lab. Because at this lab, we don't do rolling it out on a conveyor belt. I want to spend the time and build it right for you, doctor, and ergo your patient. So the biggest ones is if you can understand the chewing cycle and the general health and vitality of that person. Those are the biggest ones. And then on the ones where you're in the weeds and it's not working, then what you want is a picture of the patient, but you want a picture of their hand and their arm. And you're going to go, what? What does that have to do with teeth? On my exams of a patient, I look at their hand. Number one, do they have arthritis? Number two, what does their skin look like? Is it thin? Can you see through it? Are they bruised? Do you see pop bruising all over their arm? Because then what that's going to tell me is the adaptability of the person, the general health of the person. Then that tells me, should we be changing a lot? So if the doctor wants to open the vertical 5 millimeters and you see a person that's got bruising all over them, well, what does that tell you? It tells you they bruise easily. What do you think the denture is going to do in their mouth? The denture compresses down on the gum and is squishing and creating hydraulic pressure. It's going to bruise it. So we have to build it for the person. So on those difficult cases that are driving you nuts and they're coming back all the time, number one, get a hold of me and I'll help and talk you through it. You need a picture of the patient's hand. That's part of my consult now when I look at a patient clinically on the first appointment and I'm looking at their arm and I'm getting a feel for them. So again, when you don't see the patient, the biggest ones is the doctor can identify the chew cycle for you. Jim and I and Paul can help you because we have draft documents we can give you or help you with. You want to know the general health and vitality of that person. Are they frail? Are they a little, again, spry? That's going to help you. And then help you identify how much you should change. But I always err on the side of caution. Okay. The other thing I just want to quickly impart with you, I had a patient come in, bag full of teeth. You know, none of you guys know how to make teeth. And we started talking. And and his wife was with him because this is a big problem when you got a bag full of teeth. He's miserable. So his wife's in the treatment room with me and we're doing a consult. And during that consult, I looked at his hand and we started to talk about it. Do you know this guy vacuums out his bed before he goes to sleep? He has those little hand vacuums because he can feel any type of crust or anything, pebble in his sheets. He's that sensitive that he can feel, even if he wears pajamas, he can feel any type of debris that you get on a bed. So I looked at him and said, if you're that sensitive, and his wife now at this point's jumping up and down going, we vacuum our bed every night. I said, if you're that sensitive that you can feel that, you wonder why you have problems with your teeth, because now they're inside. The question lies with how do we build it to manage your sensitivity? So by looking here, that opened the conversation and I was able to realize, and then he realized, and treatment is more successful because then I'm watching how much I'm changing for him. How much do we change the vertical? How much, all of these things that I can do to try and make the case more successful. It's been an eye opener for me. You are building it for the person. You need to identify that. Your doctor needs to identify it. And then you have to use product that allows you to be flexible.
Excellent. Yeah, I really love it, Mark, because again, being a denturist that you are, working with the patients, you have so much of this insight on, and all these things that the learning curve that you've learned. It's nice that you can communicate this to the rest of us here watching. So I appreciate it.
Pleasure. I'm still learning. The question lies is if something fails, I always look and go, what did I miss? So everybody right now, you've got cases in your office right now that are driving you nuts. So the question lies, what are we missing? open the dialogue and find out. Because if it's this guy that vacuums his little bed out with those little vacuums, he's not crazy. He is what he is. It's not my job to say that's ridiculous. It's to say, okay, how are we going to make your teeth? Again, I look at it this way. You put ketchup on your scrambled eggs. That doesn't make you weird. You like ketchup on your scrambled eggs. Who cares? You are what you are. Stop judging people. How am I going to build the teeth for you? I just got to figure you out. That's the question.
Well, as long as it's Heinz ketchup, you're okay.
Wow, there you go.
Which reminds me, we need to do a webinar. We talk about it often. How to fix the unfixable, right? How do we the trouble, the troublemakers of our industry, right? The prosthetics that need help. How to fix something that we often feels unfixable.
Well, everybody, look. Yeah, my contact information is on there. Send me pictures. We'll talk through it. We're here to support each other. We have a beautiful dental community in this world. And when I travel, we will share information and help each other. Why? Because we've all been there. It's frustrating. We're trying to, again, manage our stress and not burn out.
So just a couple more questions. And anybody else, if you have questions that are still on, please send them through. Do you use a group function setup with your freedom concept?
So yeah, they're still working and balancing there. Yes, I still have working and balancing on the articulator. And it's just, again, it's not knuckle tight. It has a little bit more freedom and fluid in it because, again, the chew cycle is anything but exact. So the upper cusps that I showed you and marked in red function within the lower fossa, and they work in balance within the lower fossa. So yes, I do provide some degree of working and balancing contact in there, but I'm more concerned about the hit and slide. I'm trying to just eliminate the hit and slide. Okay.
All right.
Awesome. Next question.
You had mentioned the length of the crown without maybe a cervical neckline, but do you ever create your own junction with a burr, a finish line for your wax, or it works fine just waxing on top of the tooth?
It works fine. Wax on top on the neck. I just wax on top of the neck. If you want, then sometimes I lay a little bead of wax right around the collar of where I've ended the wax up. I'll just come with just a little bead of wax afterwards to kind of give it that little tone or the little roll. But I love not having a neck anymore. Again, I'm able to shape and modify the tooth better for that person.
Yeah, it's great because it allows you to very versatility on the tooth form and how you want it. So last question, the wider posterior tooth, the form, does it work well for implant cases as well?
Yes, absolutely. And with implants even more, because now what happens is, depending of course on the implant you use, you've taken it off the gum. So if it's on a bar, it's not even on the gum anymore. You've taken away that patient's perception of the hydraulics and how much it's squishing. Even if it's on a locator implant, it's controlling how much hydraulics are placed on there now. You're buggering with the central nervous system and their perception of what they've been feeling. So now you need freedom and centric even more because now there's less biofeedback going back to the brain about where they close and how they close and the strength that they close. You need that even more than ever to prevent the hit and slide. So again, the tooth is wider, and you saw that in this model. The tooth is wider than a standard dense supply tooth. Absolutely. The theory behind this was when we designed the 20-degree tooth back in the 50s, we wanted to make it a little narrower, thinking that it wouldn't interfere and it wouldn't tip the denture as much because there was less surface area in theory. And now we know that that's not the case. What we forgot was that we needed that freedom in centric along with working and balancing and some other characteristics that we have. But the freedom is where, and the chew cycle is where the interference lies. So when you're dealing with an implant case, it's the same thing now we want to watch the freedom cusps, buccal upper, lingual lower, and of course, the chew cycle of the patient even more. So, and the width is just to give you a bowl to hold the food to get crushed. Again, it has to have some girth to it to hold the food to get crushed, so it's more efficient, less chews, less chance of damage.
Get rid of that slip and slide, and
Correct.
it works well. Yeah.
Correct. You guys,
Yeah.
the hit and slide's been killing us.
Mark, that almost sounds like someone should invent a toy called slip and slide or something.
Yeah, there you go. Just for
well, we're getting into summer, so.
All right.
So I want to thank Mark. It's been terrific webinar as always. Like I mentioned, Mark has probably about another 9 months now to go with every month we're doing a webinar with you almost and others. We're going to be getting into where we can start doing maybe some hands-on courses as well in person as the North America continent gets a little bit back together, which is excellent. You see Mark's card is information on your screen. But Mark, you got any last minute?
Yeah. Just search me on social media, link on, and then we can connect. And again, I'm here to help and support you. Thanks for investing in yourself. Thanks for taking time, and thanks for taking an extra 30 minutes because we blew over by 30. But thank you for your questions. Again, we're here to support you. We want to build that relationship with you to support you. Me as from the advocate trainer perspective, Jim and Paul from, again, the technical corporate perspective. We're here to support you be successful and reduce your stress and help you and ergo your patient. So thank you. Thanks for investing in yourself. Freedom is good, and we do not slap teeth together.
All right. So I want to thank everybody for visiting us. I want to make sure that you understand that on your CE, you should get an email from VITA Education. You will respond to that, and then we'll put you down to get you your CE credits or a letter if that's what's required. This has been recorded. You can visit us on our VITA Social website, YouTube video, and revisit, if you will. If you're into wine, revisit this webinar with Mark. So please join us again in the future. And at this time, this concludes today's webinar with Mark Wagenseil. Thank you,
Thanks, everyone. Thank you. Bye-bye. Woot, woot.